Hi, my name is James Ward. I did my project on epilepsy. I had to do it twice because the first time I just did an audio file, and this time I actually made a video of the presentation. Epilepsy is a condition of the brain that causes repeated seizures, activity. There are two kind of generalized categories of seizures. They've kind of condensed them from having very specific to each type of seizure to now there's two kind of categories, which will be your focal seizures and then your generalized seizures. And as far as how they know the exact cause of seizures, that kind of either is determined through testing, also some history, and also just what is your family genetics. Maybe it might run in your family itself. But what I do like is about this picture is it kind of gives a great representation of actually what happens in the brain when there's a seizure. It's kind of like an overload of senses, so your brain actually is just firing so much that it kind of causes these abnormal behaviors, or what we'll go over later is the actual muscle contractions and shaking. So a very brief description on the two types, the focal and generalized, for the seizures. Focal is kind of just focusing on one area of the brain, while a generalized seizure is all areas of the brain are affected. So to break down the two categories with focal seizures, this is again kind of going from just seizures in general of epilepsy. Now we have the focal and generalized. Then you have focal has two categories itself. More or less, this one has to do with the loss of consciousness is a big key here on this, being that when you kind of start getting into generalized seizures, that's kind of associated with loss of consciousness each time. The focal seizures, without a loss of consciousness, you kind of just have the repetitive jerking of a body part. It could be an arm, it could be a leg. It could also be some kind of tingling sensation or something that's causing them to have either dizziness or some type of abnormal sensation. And then you also have the ones that you're just pretty much impaired awareness, as it says. And it's kind of just like the dreamlike effect. So you'll see this where they're just either staring up into the sky, or they'll be doing some type of unusual motion, is chewing or rubbing their hands together. So again, with this is the loss of consciousness is key, because you don't lose consciousness in either one of these focal seizures. And then the other one is just impaired awareness. So what's associated though with both of these is that what they've seen is there's been reports of the patients have what's called an aura, which is pretty much an early warning sign of possibly what a seizure is going to happen. This can happen with both generalized and focal seizures, but the aura is going to be your weird smell. You'll see something, they see maybe a ring in their vision, or they'll taste something different. So that aura will kind of give them an idea that they're possibly going to be having this seizure. So generalized seizures, this is going to be the ones that you probably have seen more if you kind of describe a seizure, this is what people think of. It's the actual rigid body movements, the jerking, falling on the ground, shaking. So this again goes back to, this involves the entire brain. It's not just one specific area like we talked about with focal. This is generalized, so pretty much like I talked about earlier with the picture, where everything in your brain is firing, so nothing really has control. So that's where you have these movements. And so you do have some of these though, like the absent seizures, which is what was called the Pete Mall seizure earlier. That was normally seen in children with like just eye blinking or lip smacking, but they would not be aware of what's going on, and they would probably have these over and over again. They call these cluster seizures, some happening up to like upwards of 100 times a day. The tonic seizures with a loss of consciousness is like the rigid muscles where they're like stiff as a board and you can't bend anything. Everything's pretty much like your large muscle groups are contracting and making it your body very stiff. The clonic is the actual rhythmic jerking. So some have just like the jerking motions with the loss of consciousness. And then when you have the tonic-clonic seizures, that's when you see the stiff body, also with the extremely violent shaking of a body part, all the body parts. The myoclonic seizures. This was something that I didn't really find too much information on, but it was just it says appears as a sudden brief jerk or twitch that usually affects the upper body, arms or legs. I was trying to figure out how to kind of differentiate between that and something we focused on in the focal seizures, but they had the myoclonic seizures in generalized, possibly because maybe it's associated with a loss of consciousness. Also, they have, the patients with the generalized seizures still kind of have the same type of auras that we talked about with focal, with either sights, smells, or maybe hearing something. And then also, usually with any type of generalized seizure, you usually have some type of incontinence, urinary incontinence. After it's not that's not like a telltale sign that they're having a tonic-clonic seizure, but that's how you can tell that they're actually having a seizure, is like that urinary incontinence. And usually following all this, because your brain is firing so rapidly, and it's the entire brain itself. Usually these patients have what's called a postictal state. The postictal state is when they're confused and they kind of don't know what's going on, and usually when they come out of it, they're very kind of on edge because they don't know what just happened, because of they were unaware because they were unconscious, and so now they're kind of looking up at an environment that they're unaware of. So the diagnosis to determine if you have what type of seizure or epilepsy itself. First of all, you have to have a neurological exam. It should be a very detailed exam. It also should have a blood test to make sure that the medications can possibly cause seizures. Also, any type of infections, such as like if you're septic or if you have either abnormal blood values, these also can cause seizures, like as far as like any of your electrolytes being out of balance. Again, genetic testing is one of the criteria for epilepsy, but it wasn't like something that was like if your parents or something had it in your family, it doesn't mean that you're going to have seizures. It's just a possibility, a link. And then the best way to find out all this is you're going to have a CT scan, you're going to have an EEG scan, and then the PET scan. And so for that, each scan, and then the MRI. And the best one to get is the MRI, because that's the most detailed. Usually they do a CT scan along with the PET scan. The CT scan looks for more like tumors or cysts that could cause these seizure-like activities. However, it doesn't have like a very, I think it was only like 30%. You can tell from a CT scan. An MRI, again, it allows you to see everything that you need to. It says it's the most like useful or relied on kind of test to determine what type of seizure or what's maybe causing this. There is the PET scan where they actually PET scan was something normal. I didn't have anything, not normal, but something different that I'd never really kind of heard of before, but it's something that's injected into your vein, and then it travels throughout your body, and as it's doing that, it's taking kind of pictures or information and kind of giving that back to your body, or giving it back to the actual device that's recording all this to see where these abnormalities are. It is used in conjunction with a CT scan, so you have that kind of both to determine what's going on with if you are experiencing this type of like epilepsy. For seizures is all dependent upon what type of seizure you have, and also kind of like the location and everything. If it is able to be treated with some type of anticonvulsant medication, it's highly effective. It says 2/3 of epilepsy patients taking their prescribed medications on a normal basis have a great outcome, and it kind of decreases the spread of the stimuli in the brain, and you don't have that overall like sensation just taking over your brain. There can be a seizure option, again, for which type of seizure you have. It's used in focal seizures that affect that one area of the brain instead of the generalized, which is all of it. And then you do have these devices that act on the vagus nerve to kind of stop the seizure itself. And they've also kind of found that the ketogenic diet is one with high fats and low carbs is effective in like children, and also another means of treating epilepsy. Affected population for people that are diagnosed with seizures. I found it interesting that there wasn't really any type of link to like seizures and kind of your how am I trying to say it, like the demographics. So like there wasn't anything like if you lived in a certain area of the country, if you have this type of upbringing, if anything, I found that the kind of the affected population is more or less like the ones like in the not poverty, anything like that. So like it's not affected like how you're brought up or where you're brought up or what you're being kind of experiencing. There's 3 million adults in the United States are affected with epilepsy. That's 1% of the adults in the entire country. Also, it's more likely to be diagnosed with seizures if you're a woman, and instead of the non-Hispanic population, so the white population. And then there's over about 456,000 children that are diagnosed with seizures. So it affects a very broad area of individuals just in the United States alone. So the prognosis for epilepsy, once you've been properly diagnosed and treated and being treated with the medication, the overall is a good prognosis. Again, it all depends on which type you have, what treatment you're going to be using, and then the actual effectiveness of that treatment. So like things that possibly could affect this is individuals drink alcohol, that use illicit drugs, skipping medications. There's also a couple other things that kind of affect this that will delay your kind of, I guess not recovery, but your prognosis. If you, like I said, alcohol and illicit drugs, those are very big factors because we're taking these anti-convulsant medications, also taking drugs. It just pretty much kind of alleviates the effectiveness of the medication itself. And again, like we talked about when you're first initially getting diagnosed with seizures, how they do a complete neurological exam and they want to rule out that you don't have anything underlying, such as like if you had any type of head trauma, because head trauma can cause seizures. Also anything else that's underlying, like if you've had a stroke or if you've had some type of other issue that would cause you to have like the decreased blood flow to the brain or anything like that, those can also cause seizures. So again, that's why I talked about like a complete neurological exam is very important. Then a couple other things that they list, that kind of delay this is a lack of sleep, any type of hormonal changes, stress, and dehydration are kind of some big things too that kind of affect the medications itself. And then any type of illness is just going to kind of pretty much not help yourself as far as like your treatment outcome. And then the final slide is just some questions for the presentation. I put answers in beforehand, but then I kind of removed them. I don't know if you want to see if you recalled anything or where you could go find them. So what type of seizure involves both full body muscle contractions and full body muscle rigidity? I'm going to give you an option where to find it. And what is the most effective way to treat seizures? And then what percentage of the adult population is affected by epilepsy?